Welcome to the deep dive. We're diving deep today into a stack of expert articles, all focusing on a really painful problem for our dogs and cats, dental trauma.
Hmm.
Specifically, we're looking at tooth luxation and avulsion, essentially. When a tooth gets injured, knocked sideways, pushed in, or even knocked completely out.
That's right. It's pretty serious stuff when it happens.
So our mission here is to unpack what these sources are telling us. We'll explore exactly what these injuries are, how they happen, how vets figure out what's wrong, and crucially, what can actually be done.
And importantly, what you, the listener, can do to help prevent them or what to do if, the worst happens.
Exactly. Let's get into it. Okay, so first things first. These terms the sources use, luxation and avulsion. What are we really talking about here? What's the basic difference?
Okay, think of it like this. Luxation means the tooth is displaced, it's moved from its normal spot, but it's still partially attached in the socket by that periodontal ligament.
Still hanging on, basically.
Right. Whereas avulsion, it's a complete displacement.
Yeah.
The tooth is totally out of the socket, gone.
Got it. Luxation, wrong place, still attached. Avulsion, completely out. And luxation itself has different types, depending on how it's moved.
Exactly. The sources break it down into three main types. First, there's intrusion. That's where the tooth is actually pushed up into the bone.
Ouch. So it looks shorter.
Yeah, it looks shorter than the teeth next to it, and the sources say it usually feels really solid, almost stuck in there. Then you've got extrusion. That's the opposite, where the tooth is pulled vertically, sort of partially out of the socket.
Making it look longer.
Right, longer, and it'll feel very loose, kind of wobbly in all directions. And finally, there's lateral luxation. That's when the tooth gets tipped sideways, either out towards the cheek or in towards the tongue or palate.
Okay.
And the key thing here, the sources emphasize this, is that lateral luxation always involves a fracture of that thin bone plate around the root. That's what allows it to tip sideways like that.
Ah, okay. So intrusion in, extrusion out, lateral sideways with a bit of bone damage. And avulsion is just an empty space.
Pretty much. Though the articles also mention concussion and subluxation. Concussion is like a bruise to the ligament, no real movement, maybe just painful if you tap it. Subluxation is loose, but not actually displaced yet. Less severe, but still important.
Right. Precursors, perhaps?
It could be.
Okay, this is fascinating. What actually causes these things? The sources seem very clear. It's almost always trauma.
Overwhelmingly, yes. Trauma is the big one. Think direct impact,
Yeah.
falls, unfortunately getting hit by a car, any kind of blunt force to the face or jaw.
Yeah. And something we probably see too often, fights, dog fights especially.
Hmm?
Teeth hitting bone or other teeth.
Absolutely. The sources specifically mentioned the upper canine teeth are frequently involved in those fight scenarios. They get luxated or avulsed quite often.
Makes sense.
And the other major thing the papers point to, chewing on really hard stuff.
Ah, the chew toys.
Yeah, or not just toys, bones, especially cooked bones that splinter. Antlers, those super hard nylon chews, ice cubes, rocks, even cage bars if a pet is anxious or trying to get out.
So those things marketed as long-lasting can actually be dangerous?
They definitely can be. The sources are pretty strong on that point. That kind of chewing puts immense force on the teeth. And there's another really critical factor, pre-existing dental disease.
Ah, so if the gums and bone are already bad.
Exactly. If there's already significant periodontal disease, the tooth support is weakened. So even minor trauma or chewing something that wouldn't normally cause a problem can suddenly lead to a luxation or even an avulsion.
So how would you, as a pet owner, even know this has happened? The signs sound like they could be really obvious or maybe not so much.
Well, the acute signs can be pretty dramatic, yeah. Obvious mouth pain, maybe crying or yelping, suddenly not wanting to eat or having trouble chewing.
Drooling, maybe?
Oh, yes, often drooling, and frequently it'll be bloody drool. That's a big clue.
And you might actually see the problem, right? Look in there and a tooth looks shorter or longer or crooked.
Exactly. Or, the worst case for avulsion, you just see a gap where a tooth should be.
Terrifying.
Yeah. And along with that, you'll likely see bleeding from the gum around the tooth, maybe swelling in the area. Sometimes they might hold their mouth funny or not want to close it properly if the bite feels off.
What if you didn't see it happen? Are there like longer term signs?
Yes, the sources do mention chronic signs. If an injury went unnoticed, you might eventually notice persistent bad breath, which could signal an infection in the socket or that the pulp inside the tooth has died.
Hmm.
Or you might just see behavioral changes, the pet becoming lethargic or irritable, avoiding having their head touched. That can be chronic pain. Sometimes, honestly, evidence of old trauma is just found during a routine dental checkup by the vet. A missing tooth, a discolored one.
Okay, so you suspect something's wrong, you get your pet to the vet. How do they figure out exactly what's going on? The sources seem really firm on what's needed.
Yeah, this is crucial. A thorough oral exam is step one. And the sources stress this, it has to be done under general anesthesia.
Can't do it properly otherwise.
No way. An awake animal, especially one in pain, just won't tolerate the kind of detailed look and gentle probing needed. Under anesthesia, the vet can safely examine every tooth, check for any abnormal mobility, gently tap each one to check for pain response.
And then the x-rays. The sources call them mandatory.
Absolutely mandatory. Intraoral radiography, dental x-rays, they are the definitive diagnostic tool here. You just can't skip them.
Why are they so critical?
Well, they confirm the diagnosis for sure, especially for things like intrusion, where the tooth is pushed into bone, or if there's a root fracture hiding below the gum line. They show the extent of the damage, how bad is the ligament injury, is the bone okay, is the pulp inside the tooth compromised.
Yeah.
They also check the health of the bone around the tooth, and for avulsion, make sure the missing tooth isn't, somewhere else it shouldn't be.
Right, and needed after treatment too, you said.
Yes, absolutely. Post-treatment x-rays confirm everything is back in the right place and the splint is secure, and they're essential for monitoring healing long-term.
It's interesting the sources mention that routine blood work, while important for anesthesia safety, doesn't actually help diagnose the tooth problem itself.
Right, it's non-contributory for the dental issue specifically. It tells you about overall health, kidney function, liver function, all that important stuff for anesthesia, but not about the tooth. Of course, if it was major trauma like a car hit, then a full workup is needed anyway.
Okay, diagnosis made under anesthesia with x-rays. Now what? What are the treatment options? The sources really hammer home that time is critical, especially for saving the tooth.
Time is absolutely of the essence, particularly for displaced or avulsed teeth. The goals, according to the sources, are always relieve pain, prevent infection, stabilize the tooth, and if possible, keep it alive, preserve that pulp vitality.
So let's go through the types again. Simple, concussion, or subluxation, just bruised or a bit loose.
For those, usually it's just supportive care. A soft diet for a few weeks lets things calm down. But the really key part is the follow-up.
Monitoring.
Yes.
Yeah.
Regular rechecks and follow-up x-rays, the sources suggest 3, 6, and 12 months are crucial to watch for signs that the pulp inside has died, which can happen even with these seemingly minor injuries.
Okay. What about intrusion the tooth pushed in?
For adult teeth, the sources say the prognosis for keeping that tooth alive is, frankly, poor. Extraction is often the best bet because the risks of pulp death, the tooth fusing to the bone, what we call ankylosis and root resorption are really high.
Can you do a root canal?
You can try, but the sources note it's technically very difficult when the tooth is pushed up like that. For young teeth with open roots, there's a slim chance they might re-erupt over weeks, but you still have to monitor them like crazy for pulp problems. Many end up needing treatment later anyway.
Got it. How about extrusion pulled partially out and lateral luxation tipped sideways?
Right. For those, the goal is gentle repositioning. You carefully nudge the tooth back into its correct spot in the socket. Then, the critical step is stabilizing it.
Splinting.
Exactly. Splinting it to the neighboring stable teeth. The sources talk about using rigid or semi-rigid splints, often made with dental composite and wire, usually for about 2 to 4 weeks. This holds it steady so the ligament can heal.
But the pulp is still at risk here too.
Oh, very much so. High risk of pulp necrosis, especially in adult teeth. The recommendation often is to do a root canal soon after repositioning, maybe within a week or so.
Wow, that quickly.
Yeah, or if not done right away, then very close monitoring with x-rays is essential, and do the root canal as soon as you see signs the pulp isn't vital. Young teeth might be candidates for trying to keep the pulp alive, vital pulp therapy, but again, needs super close watching.
Okay, the big one. Avulsion. Tooth completely knocked out. Can you actually put it back?
It is possible, yes. Reimplantation. But, and this is a big but, only if the conditions are pretty much ideal.
What are those ideal conditions?
The sources list a few key things. It needs to happen fast. Ideally, the tooth is out for less than 30 to 60 minutes. Max.
Wow.
Yeah, time is everything. It helps if it's a young animal. Their teeth have a slightly better shot at regaining blood supply. The root surface shouldn't be badly damaged. And crucially, how the tooth was handled before getting to the vet.
Okay, that handling part sounds critical. What should you, the owner, do if you find the tooth?
This is so important. If you find it, gently rinse it, only with sterile saline if you have it, or milk. Regular tap water is bad. Disinfectants, even worse. They kill the delicate ligament cells on the root.
Okay, saline or milk, no water.
Right. Keep it moist. Best options are putting it in a little container of milk or saline. If you can, and the pet is okay with it, you could even try gently putting it back in the socket yourself, just for transport. But the absolute key is, do not touch the root surface. Handle it only by the crown, the part you normally see.
Got it, crown only. Keep it moist. Get to the vet fast.
Exactly. At the clinic, they'll gently clean the socket, carefully replant the tooth, and then splint it for, again, usually 2 to 4 weeks.
And what about the inside, the pulp, for these adult teeth put back in?
The sources are really clear on this. Revascularization, getting blood supply back, is highly unlikely in mature adult teeth. So a root canal is considered mandatory for any reimplanted adult tooth.
Mandatory.
Yes, to prevent infection boiling up from the dead pulp later on. It's often done either right away or when the splint comes off. Young teeth have a slightly better but still guarded chance, but often end up needing root canals too.
Are there times when you just shouldn't even try to put it back?
Definitely. The sources say don't try if it's a baby tooth, or if the tooth was already really unhealthy, severe periodontal disease, big cavity, resorption, or if the conditions just aren't right, tooth was out too long, root is damaged or dirty.
Which sounds like it might be common.
It is. The sources state that, unfortunately, extraction is the most common outcome for avulsed teeth, simply because those ideal conditions for reimplantation often aren't met.
So extraction is the go-to if saving it isn't feasible.
Yes, and it's a very good option. It removes the source of pain and infection completely. Excellent prognosis for just resolving the problem and making the pet comfortable.
And managing the splint while it's on. Any tips there?
Yeah, the sources say keep it clean. That splint is usually on for maybe 4 to 6 weeks total for ligament healing. Gently flushing around it with water, maybe using a water pick on a low setting or a curved tip syringe, is good. Rinsing with a chlorhexidine solution helps keep bacteria down.
Does good cleaning mean fewer antibiotics?
It can, yes. Reduces the need for prolonged antibiotic use. Then the splint is removed, carefully, with special pliers or a drill. If the tooth is still really wobbly after the splint comes off, that usually means it didn't take, and extraction is needed then.
Makes sense. Beyond the actual fix, what about meds and ongoing care?
Pain relief is key, of course, usually an NSAID, a non-steroidal anti-inflammatory for a few days, and antibiotics, typically a broad-spectrum one. As we said, if hygiene is good, maybe a shorter course is needed.
And that follow-up sounds like it's not optional at all.
Absolutely non-negotiable. The sources really stress this. For reimplanted teeth, that root canal is essential in adults to prevent infection later, no question. And even for luxated teeth that were just repositioned, the risk of the pulp dying later is high. So regular checkups with x-rays at those set intervals 3, 6, 12 months, sometimes longer, are needed to catch problems early.
What are they looking for on those follow-up x-rays?
Signs the pulp has died, like changes inside the tooth or around the root tip, or signs the root is being eaten away, resorption, or that the tooth is fusing to the bone, ankylosis. Catching these means you can intervene, usually with that root canal, before it becomes a bigger, more painful problem.
Right, those complications like resorption and ankylosis were mentioned as risks, especially after reimplantation.
They are. It just underscores why you can't just fix it and assume it's fine. Long-term monitoring is part of the deal.
This has been incredibly detailed. It really highlights how serious these injuries are. So what can listeners do to prevent this? Any practical advice from the sources?
Yes, definitely. Owner education is key here. The single biggest recommendation across the board is avoid feeding or giving really hard chew objects.
Okay.
The sources offer a great rule of thumb, actually. Too hard for your head, too hard for their teeth.
Huh. That's memorable. So if you wouldn't want to bang your knee with it.
Probably too hard for your dog or cat to be chewing on safely. Think about denting it with a fingernail if you can't. It's likely too hard.
So what specific things fall into that too hard category, according to the sources?
Bones, especially the cooked ones. Antlers are a big one. Ice cubes, those really rigid nylon toys. Hooves, rocks, obviously. Even some rawhides if they dry out and become rock hard.
What are safer alternatives then?
Things like flexible rubber toys, Kongs are often mentioned, softer dental chews that are designed to have some give. Puzzle toys where you hide softer treats inside. And supervision during chewing is always a good idea. Also, just basic environmental safety, preventing falls, making sure enclosures are safe so they don't chew cage bars, and, back to what we said earlier, keeping up with routine dental care to manage underlying periodontal disease. Healthy teeth are stronger teeth.
Okay, so bringing all this amazing detail together, what's the bottom line for our listeners as pet owners? The sources had a whole section on client education, didn't they?
They did. And the number one message is, dental trauma is an emergency. Get to the vet promptly. It makes a huge difference in the outcome, both for saving the tooth and managing pain. And remember, these injuries hurt, even if your pet isn't acting dramatically.
And understanding why the vet needs to use anesthesia and take those dental x-rays is key. It's not optional for a proper diagnosis.
Absolutely. Be prepared for that. And be ready to discuss the options with your vet: repositioning, reimplanting, extraction, root canals. Understand the pros, cons, the likely success rate for your pet's specific injury, and the costs involved. Complex cases might even need a specialist.
And if, heaven forbid, a tooth gets knocked out, remembering those immediate steps you outlined. Rinse with saline or milk only. Don't touch the root. Keep it moist. Get help fast. That can make all the difference.
It really could. Those first few minutes are critical if reimplantation is even going to be a possibility. Also, just being aware that the follow-up, the monitoring with x-rays, is essential. It's not over when the initial procedure is done. You need to watch for those complications. And yes, be prepared for the fact that advanced dental work can be costly.
And finally, that prevention advice is something everyone can act on right now.
Exactly. Take a look at those chew toys. Apply that too hard for your head rule. Making safer choices there is a really practical way to reduce the risk of these painful problems happening in the first place.
Wow. That was a seriously deep dive. It's amazing how complex something like a tooth injury can be in our pets.
It really is. It underscores that, dental health is just such a critical part of their overall health.
Yeah.
And trauma needs careful, informed management, understanding the injury types, the need for anesthesia and imaging, the follow-up. It's all vital.
And just realizing that something as seemingly innocent as a chew toy could potentially lead to needing emergency vet care and maybe even complex surgery. That's a powerful takeaway about prevention.
Indeed it is. And knowing what to do in that emergency, how to handle an avulsed tooth, getting help quickly, can genuinely impact whether that tooth can be saved and, more importantly, how quickly your pet gets comfortable again.
So what does this all mean for you listening right now? Maybe it is time to rethink those super hard chews you have at home, or perhaps it's just storing this information away, hoping you never need it. But knowing that prompt informed action is absolutely crucial if you ever suspect dental trauma. It really makes you consider those hidden vulnerabilities our pets carry, even in their mouth, and how much our informed choices matter for their well-being.